Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're embarking on a fascinating journey through time. Treatment Timeline, Evolution of Sickle Cell Care, Part 22. Before we dive into this incredible story of medical progress, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people interested in the history and future of sickle cell treatment. The story of sickle cell care is one of resilience, innovation, and hope. From its first description in medical literature to the cutting-edge treatments of today, the evolution of sickle cell care reflects humanity's relentless pursuit of better health outcomes. Today, we'll explore how far we've come and glimpse into the exciting future of sickle cell treatment. Imagine the year is 1910. Dr. James Herrick, a prominent physician, discovers peculiar sickle-shaped cells in a dental student's blood sample. This marked the first official recognition of sickle cell disease. A seemingly ordinary day in the life of Dr. Herrick had turned into a moment of medical history, thanks to an astute observation. These abnormal cells, shaped like a farmer's sickle, were nothing like he had ever seen before. The mystery of these unique cells sparked curiosity and paved the way for further scientific exploration. Dr. Herrick's discovery was just the beginning. Over the next few decades, scientists delved deeper into the enigma of these sickle-shaped cells. They wanted to understand why they existed and how they impacted the human body. The world of medicine watched in anticipation as each piece of the puzzle fell into place. Fast forward to 1949, another significant year in the timeline of sickle cell disease. Dr. Linus Pauling and his colleagues made a groundbreaking breakthrough. They identified sickle cell disease as the first molecular disease, linking it to a specific genetic mutation. This revelation was a game changer. It was the first time a disease had been tied directly to a glitch in the genetic code. This discovery not only deepened our understanding of sickle cell disease, but also opened up new frontiers in the field of genetics. It sparked a revolution in medical science, leading to the exploration of genetic links in other diseases. The realization that our genes could hold the key to understanding various health conditions was an idea that would shape the future of medicine. Thus, the early 20th century marked the dawn of our understanding of sickle cell disease. It was a time of discovery and early understanding, an era that laid the foundation for the advancements in sickle cell care that were yet to come. Little did Dr. Herrick know his discovery would ignite a century-long journey of resilience, innovation, and hope. Fast forward to the mid-20th century, medical professionals focused on managing symptoms and complications. During the supportive care era, spanning from the 1950s to the 1970s, the primary goal of sickle cell treatment was to alleviate symptoms and prevent complications. This was a time when the medical community began to understand the importance of enhancing the quality of life for patients living with this chronic condition. In this era, supportive care took many forms. It included hydration to prevent sickling of cells, pain management to alleviate the intense pain episodes associated with the disease, and blood transfusions to replace sickled cells with normal ones. It was also during this time that the medical community recognized the critical role of comprehensive health maintenance, including regular checkups and vaccinations in managing sickle cell disease. A significant breakthrough of this era was the development of antibiotics, particularly penicillin, which played a crucial role in preventing infections, a common and often fatal complication in sickle cell patients. The introduction of newborn screening programs in the late 1960s further bolstered supportive care by enabling early diagnosis and intervention. However, the supportive care era was not without its challenges. Managing sickle cell disease was a delicate balancing act. Care providers had to navigate the complexities of treating a disease that affected multiple organ systems, while patients often grappled with the psychosocial burden of living with a chronic illness. Despite these hurdles, the supportive care era marked a significant turning point in the history of sickle cell care. It shifted the focus from simply identifying the disease to actively managing it, thereby laying the foundation for the more targeted treatment strategies that would follow in subsequent eras. While the supportive care era was crucial, it was just the beginning of the journey towards a more comprehensive treatment approach. And as we continue this journey, we'll see how the tireless efforts of researchers, clinicians, and patients led to the development of groundbreaking treatments that have transformed the lives of those living with sickle cell disease. Enter the 1980s, and a new hope emerged with the discovery of hydroxyurea. As the third chapter in our timeline unfolds, we witness a game-changing moment in the history of sickle cell care. The 80s and 90s were an era of revolution, not just culturally and technologically, but also in the realm of medical science. And at the heart of this revolution was the introduction of hydroxyurea, the first drug specifically approved for sickle cell disease. Hydroxyurea was originally developed as a cancer treatment specifically for leukemia in the 1960s. However, by the late 1980s, researchers began to explore its potential use for sickle cell disease. The drug works by increasing the production of fetal hemoglobin, a type of hemoglobin that resists sickling and helps keep blood cells flexible and round. This, in turn, reduces the frequency of painful crises and hospitalizations, a common plight for individuals living with sickle cell disease. As the 90s progressed, clinical trials provided compelling evidence of hydroxyurea's efficacy in managing sickle cell disease. The results were so promising that in 1998, the U.S. Food and Drug Administration approved hydroxyurea for the treatment of sickle cell disease. This was a monumental achievement, marking the first time a drug had been specifically approved to manage this condition. The impact of hydroxyurea on the lives of those affected by sickle cell disease cannot be overstated. For many, it meant a dramatic improvement in their quality of life. It reduced the number and severity of pain crises, decreased the need for blood transfusions, and even extended life expectancy. However, it's important to note that hydroxyurea is not a cure. It requires ongoing use, and its efficacy can vary from person to person. Furthermore, like all medications, it comes with potential side effects, including bone marrow suppression and gastrointestinal issues. Despite these caveats, the introduction of hydroxyurea was a significant stride forward in the fight against sickle cell disease. The approval of hydroxyurea was a major milestone in the history of sickle cell disease treatment, and as we'll see in our next chapter, it paved the way for an even more comprehensive approach to care. As we moved into the 21st century, the focus shifted towards a more holistic management of sickle cell disease. This era, known as the comprehensive care approach, brought with it a fresh perspective on how to handle this intricate disease. Instead of merely reacting to crises as they arose, healthcare providers began to emphasize the importance of regular checkups, vaccinations, and lifestyle modifications. The comprehensive care approach is akin to a well-oiled machine, where every cog plays a crucial role in the overall functioning. It's not just about treating the disease, but also about enhancing the quality of life for the patient. Regular checkups, for instance, are instrumental in the early detection and management of any complications that might arise. By closely monitoring the patient's health, doctors can nip potential crises in the bud. This proactive approach not only reduces the frequency and severity of crises, but also aids in the preservation of organ function. Vaccinations, too, play a significant part in this approach. As individuals with sickle cell disease are more susceptible to infections, keeping up to date with vaccinations is paramount in preventing avoidable complications. And then we have lifestyle modifications. These include a balanced diet, regular exercise, staying hydrated, avoiding extreme temperatures, and managing stress. While these might seem like simple measures, they go a long way in improving the overall health and well-being of the patient. This comprehensive care approach also extends to psychological and social support, acknowledging the impact of the disease on mental health and quality of life. Support groups, counseling, and mental health services become part of the care package, offering a helping hand to patients and their families as they navigate the challenges of living with sickle cell disease. The comprehensive care approach marked a new era in sickle cell disease treatment, focusing on the patient's overall well-being. This holistic strategy, which looks at the individual as a whole rather than just the disease, has proven to be a game-changer in the management of sickle cell disease. In the last decade, medical science has taken a quantum leap towards a potential cure for sickle cell disease. We've been traveling through time, examining the evolution of sickle cell care, and we've finally arrived at our current era, the gene therapy promise. This period, stretching from the 2010s to the present, is marked by ongoing research and clinical trials in gene therapy and CRISPR gene editing. Gene therapy is a revolutionary approach that modifies a patient's own stem cells to produce healthy hemoglobin. This technique holds the potential for a cure without the need for a donor, using the patient's own cells. However, it's important to note that this treatment is still experimental. The long-term effects are unknown, and currently it's a very expensive procedure. CRISPR gene editing, another cutting-edge technique, is also on the horizon. This method allows scientists to edit genes with extreme precision. In the context of sickle cell disease, it offers the promise of correcting the faulty gene that causes the disease, potentially providing a permanent cure. However, like gene therapy, CRISPR is still in the early stages of development. The long-term effects remain to be seen, and the cost could be prohibitive for many patients. Despite these challenges, these new techniques offer a glimmer of hope. They represent the culmination of over a century of progress in understanding and treating sickle cell disease. Each breakthrough, each new treatment, brings us one step closer to a world where sickle cell can be effectively managed or even cured. So here we stand, at the forefront of a new era in sickle cell treatment. The journey has been long, and there is still much work to be done. But as we look back at how far we've come, we can't help but feel hopeful. While we are still at the forefront of these promising treatments, the future looks bright for those battling sickle cell disease. Before we wrap up, here's a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this journey through the history of sickle cell care. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more content that educates and inspires. Until next time, this is Maurice, reminding you that with each passing year, we get closer to victory over sickle cell disease.